Hello, everyone, and welcome to another session of the Congressional Fire Service Institute Virtual Symposium. I'm Dr. Lori Moore-Merrell with the International Public Safety Data Institute, and I'm thrilled to be with you today, along with my colleagues who are going to be sharing with you information about the National Firefighter Registry. Dr. Kenny Fint from NIOSH is joining us, and Kenny is the lead on the National Firefighter Registry, appointed by NIOSH to see the effort through to its conclusion and the rollout of the registry. Mr. Pat Morrison is with the International Association of Firefighters, and Pat is an assistant to the General President in charge of health, safety, and medicine for the IFF. And finally, Chief John Oates, who is the chief of East Hartford, Connecticut, will be joining us to talk about exposure tracking related to the NFR. A little bit of background on the National Firefighter Registry and its intent to better understand firefighters' risk of cancer. As you all may remember, in 2018, we did a lot, we being the fire service, did a lot of lobbying to be able to get this cancer registry, now known as the National Firefighter Registry. Not only did the CFSI, but the IFF, the IFC, NVFC, and many others lobbied very strenuously to be able to pass this bill that was signed into law in 2018. So much progress has been made. There's yet a lot to be done, but Dr. Kenny Fint now is going to tell us more about the progress and what remains to be done, and when we may see the National Firefighter Registry live for you to participate. So Dr. Fint.
Thank you, Lori. And thank you everyone for spending some time with us this morning. I'm really excited to be able to provide an update on this really important effort, the National Firefighter Registry. I do want to acknowledge Dr. Miriam Siegel, who's the lead epidemiologist on this project and was really instrumental in creating many of these slides that we're going to go through. So in the United States, there are over 1 million firefighters that protect our communities, homes, and environment. And every year, these firefighters respond to, 1.4 million fires, including 500,000 structure fires. And it accounts for about 1 to 5% of a firefighter's time is spent at structure fires. And anytime you burn anything, you're going to produce hundreds of different compounds. And dozens of recognized carcinogens have been identified at the fire ground by the International Agency for Research on Cancer, or IARC. And IARC is really the world's governing body that looks at environmental causes of cancer. And interestingly, IARC actually evaluated the occupation of firefighting for its carcinogenicity back in 2010. And at that time, they classified firefighting as possibly carcinogenic to humans. However, just recently, IARC has determined to reevaluate the occupation of firefighting in 2022. And one of the reasons they want to reevaluate firefighting is because of all the new studies that have come out in the last 10 years. So one way of looking at all the research that's been done over the years is what we call a meta-analysis. And a meta-analysis is a way of taking a lot of the studies that have been conducted and combining them to increase the statistical power and be able to draw conclusions about what specific cancers are elevated among firefighters. Dr. Grace LeMasters from the University of Cincinnati did one of the first meta-analysis back in 2006 and looked at 26 studies and found that there were 4 cancers that appear to be elevated in firefighters. Then IARC, when they did their evaluation of firefighting, did their own meta-analysis and added to those studies, had 44 total, and found that there were 3 types of cancer that appeared to be statistically increased in firefighters. But just within the last few years, there's been additional meta-analyses that have been conducted with even more current studies, or in the case of Kasjan's, really focusing on the most robust or strongest studies. And these meta-analyses have identified additional cancers that appear to be increased in firefighters. So this table is really my attempt to try and synthesize what are the largest cancer studies that have been done on firefighters since 2014. And 2014 was the publication date for the NIOSH firefighter cancer study, and that is really the largest cancer cohort study of US firefighters to date. But since then, there have been some large studies of firefighters in other countries, as well as specific states in the United States. I realize this is a busy table, so I'll just try to walk you through it here. Anywhere you see a symbol, that study found an increased risk of cancer. X means it was increased for all firefighters. M was just for males. F was for females. NW was for non-white firefighters. And then there are some lowercase letters that denote increases among younger or older age groups. But the bottom line is, anywhere you see a symbol, there was an increased risk of that particular type of cancer. So you'll notice that that these studies are consistent in some ways and inconsistent in others. But if we overlay the cancers that were identified in the meta-analyses, you'll notice that that there are a variety of other cancers that appear to be a problem in the fire service. So I want to talk a little bit more about the NIOSH firefighter cancer study, because that, again, is the largest study of US firefighters. It was a retrospective cohort study of career structural firefighters employed between 1950 and 2009, and it compared cancer rates to the general US population. These were firefighters that were employed in 3 large municipal fire departments. It was a records-based study and compared to both cancer incidents from data from state cancer registries, as well as death certificates. And this study found that there was an overall increased risk of cancer, both in terms of mortality and incidence. And digestive, respiratory, urinary, and oral cancers were the ones that were most elevated. There was actually a 2020 update of this study looking at new mortality in this cohort, and that update found that there was also a increase in non-Hodgkin's lymphoma mortality. This study did look at non-white firefighters and female firefighters and found that there were what appeared to be increased risk of certain types of cancers in those subgroups, but it really lacked the statistical power to draw conclusions about those cancers, as well as some other cancers, because it didn't have enough of these groups of firefighters. So by looking at these studies, we can draw some important conclusions, and these are studies within the last 10 years, but we can also identify some important knowledge gaps that still exist. And so, these studies clearly appear to indicate a report between firefighting and cancer. But what is it about firefighting in particular? Is it how long you're a firefighter? If you're in a busy firehouse, is it the type of job that you do? There's a lot of different job titles out there in the fire service. So those are questions that remain to be answered. As I mentioned, some of these studies did attempt to look at cancer in women and minorities, as well as other groups of firefighters, but the results are really inconsistent. And And many of these studies just didn't have enough of these subgroups to really explore the cancer rates. So, how does the cancer vary among these different groups, where you have women that make up about 8% of the fire service, minorities who make up about 20%, and then of course, volunteer firefighters make up a large majority of the fire service as well. And then, overall, the magnitude of these risk estimates appear to be small compared to some other known risk factors for cancer, for example, smoking. And so that begs the question, how do these non-firefighting characteristics affect firefighters' risk of cancer? The one thing I want to say about this is that when you look at career firefighters, we know that in general, they're healthier than the general population, in which case you would expect them to actually have lower risk of cancer. So why is it that we're seeing a higher risk of certain types of cancer? So these knowledge gaps, I think, are really what motivated the Firefighter Cancer Registry Act of 2018. And the goal of this is really to track cancer and risk factors over time to better understand the link between workplace exposures and cancer, with the ultimate goal of reducing cancer incidence and death. So the NFR, it's really important that we convey this message to all of the fire service. The NFR is for all firefighters, not just those with cancer. So one of the reasons we're calling it the National Firefighter Registry instead of the Firefighter Cancer Registry is that we don't want firefighters to think that you have to have cancer to register. This is really an exposure registry, and we know that all firefighters are exposed to carcinogens. So we want to make this available to any firefighter in the country to register. Registration is completely voluntary. We will have a focus on really reaching out to women and minorities and volunteer firefighters because they have been understudied. But we're also interested in subspecialties like instructors, wildland firefighters, and fire investigators. Because again, there's so much that we don't know about those different groups. And our goal is to enroll 200,000 firefighters once we open enrollment over the next few years. So the enrollment system is really the biggest part of what we're doing, and it's what's taking the longest time. But it's taking the longest time because there are a number of new federal data security requirements that we have to meet. And it's really critical that we get this right and that we comply with all those regulations. So it is still under development, but we do know that enrollment's going to involve informed consent, the collection of some personal information, as well as details on demographics, work history, workplace practices, including the adoption of control interventions, lifestyle, and health history information, as well as some important voluntary follow-up questionnaires that would allow us to really dig in and look at some other occupational factors that we want to better understand. But the initial enrollment, we think, will take about 30 to 45 minutes. Could take less for younger firefighters and maybe a bit longer for older firefighters, just because we have to really capture that work history information. So we understand that if a firefighter develops cancer, the last thing on their mind is going to be reporting that cancer to us. So we want to collect enough information from the firefighters, enough personal information, so that we can then link to state cancer registries. So all 50 states in the United States have their own cancer registries where they document all cancer diagnoses in that state. And so, we'll collect enough information that we can link to those state-based cancer registries. And that allows us to really investigate cancer incidents over time. We'll also want to link to the National Death Index, which is the national database of all causes of death in the United States. And so that will allow us to look at cancer mortality, but also other causes of death that may be important and possibly related to the occupation of firefighting. So this is just our general timeline that we're operating on. 2020 was all about getting up and running, getting our protocol in place, all the scientific methods that we want to use. And we also established what we're calling an NFR subcommittee, which is really our advisory committee that included both fire service and scientific stakeholders. And they reviewed a lot of our plans and our methods that we've come up with and gave us really good feedback, which we've incorporated into what we're doing. So here we are, 2021, and like I said, most of our effort is just getting this registration system architected and up and running so we can start enrolling firefighters. And then the plan is to collect data. When I say collect data, I mean also register firefighters over the next 2 or 3 years. And then because cancer has a long latency period, this is a long-term project. We anticipate following these firefighters over the next decade or two. So that's all I have. I do want to mention, I know we're going to have questions at the end, but I do want to mention that if we're unable to get to your particular question, please feel free to reach out to me. We have our own email address listed here, as well as my own work email address. Don't hesitate to reach out to me. And I just want to acknowledge the team that we have that's been working diligently on the NFR over the last couple years, in the middle of a pandemic, no less. So I just want to thank everybody that's on our team. And I want to thank the fire service for all their support as well. So now I'm going to turn it over to Pat Morrison.
So listen, I want to thank everybody for joining this session. Dr. Fent just did an excellent job, and I really want to thank him for all his work. And he's worked with the fire service for so many years, and he's presented at a lot of conferences. And he's just such a good partner, and NIOSH is such a great partner to have in this project. I'm going to go over, sort of, it's not the most exciting stuff, but I really want to kind of talk in the next couple of minutes that I have about the process. I want to let you all know how many layers of process there was and just to get to the point where we're at today. And it's very exciting that that we are getting ready to launch this project pretty soon. And I'm going to go through that process, with you, and especially with the Cancer Registry Act there too. But I always start, I just want to give you, the audience to let you know, at the International Association of Firefighters, we have our yearly Fallen Firefighter Memorial, and that's where we honor those who have died in the line of duty. We were one of the first fire service organizations that really recognized, certain cancers in the fire service as a line of duty, death. And what was alarming for us over the years in the trend line was that you can see here that the names that we put on the wall, we put on 250 names last year, 79% of those were cancer deaths. I mean, that has increased over a period of time. And that has given us the the push to make sure that we're doing whatever we can. And it's not just recognizing those cancers, but we really, in some cases, we've looked at the IFF at the prevention programs, because I think it's very, very important on the prevention programs. But if we don't have the data, if we don't have that science, if we don't have any of this, we're not going to get to where we want to go, recognizing certain cancers. And sometimes if we can recognize those certain cancers, can we go back and really look at the epigenetic, sort of portion of that, and why is it that firefighters are getting certain cancers? And we're getting closer. I mean, science is getting closer in so many different ways. But I always just want to say that, this is a fact. Firefighters are getting cancer at a much higher rate, and it's not going down. It's actually going up. And Lori had said she started, and with the Firefighter Cancer Registry Act of 2018. That just doesn't happen. That Congress just doesn't give money away, and that's gonna this is gonna take place. And we're gonna have a cancer registry. The IFF and our affiliates, we worked very, very hard lobbying along with a lot of other fire service organizations to make this a law. We really, this was our number one, and the National Firefighter Registry. And if we did anything, and Dr. Fent talked about that, we don't call it the National Firefighter Cancer Registry. We call it the registry because we're going to have, and like he said, it's real important for us that we're going to have firefighters in this pool that don't have cancer, and we need them. We need different groups to sign up on this thing here too, and those that might have cancer, that's one group, but those that don't, we're gonna be tracking those also. So this was a lobbying effort that took place on the Hill, and working with a lot of individual groups to make this happen. And I want to applaud the fire service for really making this a reality. Now I want to kind of go through. I mean, okay, so we have the Firefighter Cancer Act that we're going to actually, put forward to the fire service. But how does this happen? What actually has taken place? And this has been an amazing process for me to be involved in. And when I look at that, you have Congress that directed CDC basically, but how does that get to CDC? It was really the Secretary of Health and Human Services, where that secretary then brings it down to the Director of Center for Disease Control and Prevention. And really underneath that is NIOSH, just to let you know that, this was at the highest level. It had to get passed through Congress, then it had to go through secretary positions to make this thing a reality. And all along, this whole project is to better understand the link, between our exposure as firefighters with cancer and the toxins. What are those toxins causing? We have a lot of discussion out there with the cancers that we have. And then really what it came down to, like I said, it was NIOSH and Director John Howard. John has been around for several administrations. That just is a testament that he has straddled both sides of the political spectrum here, and he's been appointed and reappointed. But really, Director Howard, it was his charge. I mean, it really came down to, okay, how are we going to make this happen? Who's going to put this together? And I just want to give Director Howard, just a shout out that he's an incredible individual. He's always looked at the health and safety of the fire service, and he's somebody that has done an amazing job over the years that he's been with NIOSH. But it actually got to his level, to that point there. And the act, just to let you know that the act, it wasn't just that, okay, NIOSH, here you go, here's the act, here's Congress, we passed this. It actually had in that, including, who has to be part of this? It's got to be public health experts. It's got to have that experience in that. It's got to be those research people, the epidemiologists, and those that really understand studying cancer, at a much deeper dive within the data. Clinicians that, for firefighter clinicians around the country and places that are diagnosing and treating cancer. And then it's got to have the end user. And this is where I really want to, say that this is something that was really well thought out, because the end user is, the volunteers, the retired, the paid on call, the career firefighters, as well as the national fire organizations. And NIOSH has really made it a point. They really have. They've reached out to the IFF. I know they've reached out to other fire service organizations, and they just didn't even reach out. They listened to us. They listened to what I always consider a lot of people's failure in their research project, not getting to that end user and trying to understand some of the complexities of the fire service with that. And then we had other departments that were part of this group. So I mentioned that NIOSH, basically I'll start with there. And NIOSH has a National Institute for Occupational Safety and Health Board of Scientific Counselors. And that's a federal advisory group that really that provides advice in a lot of ways to NIOSH. And this committee is really an incredible committee of individuals. But it really is their charge is to really, to let NIOSH know where should the health research go? Where should the preventions go? What currently is out there? And they really advise, and not only advise NIOSH, they really kind of set the standard, and they have a pretty high bar. I mean, it's not, if you're gonna do a study like we're about to do, the Board of Scientific Counselors have they want to know exactly what are all those elements that are part of that, and they really want to know, what are we studying? And a lot of these are not firefighters, but they are the experts in that field that I showed you just earlier. And they really have the ability to make sure that whatever we're doing, we start off right. There's nothing worse than a project and a registry when you start off with bad science, with bad data. So we have to make sure that we have the right information. And that Board of Scientific Counselors is made up of 15 experts, and they, like I said, they cover a wide breadth of from industrial hygienes to the ergonomics to to a lot of different fields in that. And then among those 4 members may be representative industry of labor. Again, even the Board of Scientific Counselors through NIOSH is recognizing that the fire service needs to be involved in that, and they actually brought in the industry, and I was fortunate enough to represent labor on the Board of Scientific Counselors on that. I keep waiting for them to kick me off the board once they find out that I'm really not a scientist in any stretch of the imagination. I do have fire service background, but anyway. What that group did, and that Board of Scientific Counselors, and NIOSH has not done this over the years. This is truly amazing. They were able to put a subcommittee together, and these aren't easy subcommittees to just spring up. I think that the last subcommittee was several years back, and the fire service and the National Firefighter Registry had a subcommittee, and that subcommittee was really to address. To the Board of Scientific Counselors. Again, now that subcommittee is going to go up to the Board of Scientific Counselors and really give them advice as to what they see in the whole project. And that subcommittee really was a wide variety of people in the fire service, from volunteers, paid on call, career firefighters, strong minority representation. But that subcommittee, Dr. Grace LeMasters, who Dr. Fent mentioned earlier, who I consider to be sort of the pioneer in firefighter research, her study, her original meta-analysis really, at the IFF got us thinking in terms of what additional research we need. And Grace LeMasters was one of the leads on the subcommittee, and she really guided the subcommittee, and her incredible wisdom and experience over the years really helped make this a better project. So just to let you know, so we've gone from the Board of Scientific Counselors, we've put together a subcommittee that was a makeup of the fire service and a lot of other areas. And then that subcommittee reported back through us, through Dr. LeMasters and myself, to the Board of Scientific Counselors, to Director John Howard, as to the project, the scope of it, what changes, what are needed. And I think I have some of that information on here, but it was really, that group needed to understand, and why that subcommittee was so important. It needed to advise them on, what is the fire incidents? How many incidents is this? So what are we going to be capturing on this? What is the standard method of this? How can we estimate exposures with firefighters, which is extremely important, and we were able to do that. Well, we were able to give new information about firefighters that will be submitted. We were able to, to maintain, this information. How are we going to maintain this over time? And looking at methods, and they really looked at us as that subcommittee, and all those questions that they had for us, that subcommittee was recommending. And we had a lot of areas in there, and there were some, will firefighters give Social Security numbers? That was a big, huge issue for us, and we brought it back to the IFF, and we realized that if we have to, we are willing to go ahead with that full Social Security number if we can go down to something less. But anyway, those were the kind of questions that they asked us as the subcommittee to really take this information and to see what will work in the fire service. The thing that you don't want to start, like I said earlier, if you start off bad, you're going to end up bad. You really want to get all these questions out there. And there is no better group than the fire service itself giving that information. And that's what's happened. I just want to let everybody know that this was not done in a vacuum. This was done in a, in a wide scope of information. That kind of concludes my, formal presentation. I just want to kind of address those that are watching this, how important it's going to be for us to be involved in this, how important for us to get the recruitment side of this, how important it is, for firefighters to sign up across the spectrum. One of the areas that the Board of Scientific Counselors really looked at was what groups, how many, how are you going to target those minorities? How do you plan getting out there? And it was soon, recognized that the fire service is the best way to get that information out there. It's, those fire service organizations that represent their particular group. When they give that information out there, people might act, with that. And I know that the IAFF, if we not only strongly support this project in the recruitment side and why we need people to sign up, but our members will take a look at the IAFF leadership and saying, okay, if they are endorsing this, they had to be part of, and we were part of the initial process, and we're going to continue with this process, that they actually allow us to, to continue. So again, my hat's off for, for NIOSH taking this from Congress, putting it on the conveyor belt, coming down. It's not easy. It's a process. It's not an event. It's going to take us a while, and we're going to, we're going to have some growing pains. But I can tell you from our perspective at the IFF, this is not only an exciting project for researchers for decades, like Kenny said, decades out looking at this. This is exactly what we need to identify. And the main goal of this is to reduce the cancer prevalence and the cancer deaths in the fire service. So with that, I am going to close, and I'm going to introduce our next speaker, Chief John Oates from the East Hartford Fire Department. And John, it's all yours.
Thank you, Pat. And I appreciate the opportunity to contribute today, and certainly appreciate the Institute for having this important seminar. And you've listened to what Dr. Fent offered and what Pat offered as far as how we got to today with the National Fire Registry. And I'm sure some of you are like, all right, well, I ride facing backwards on engine 3 on B tour. What does that mean to me? And I think they illustrated to you why it's vitally important across the entire spectrum of the fire service: career, volunteer, wildland, instructors, volunteer, combination. It doesn't matter what the makeup of your organization is. You have a stake and you have a role in this going forward, both personally and for the entire fire service that all of us belong to and have a stake in. So I want to talk a little bit about exposure tracking, because creating that data set and creating that information that the registry can have access to or could have access to is vitally important. And you look at, both with the National Registry and with many of the reporting requirements that our communities, our states, or our tribal nations, our provinces have relative to cancer legislation, it includes an exposure requirement, and how you track that. And was the firefighter exposed to a known carcinogen identified by IARC? Was that exposure due to your work as a firefighter? And did that exposure lead to a cancer, a leukemia, or did we just mark it because we're not sure what's going to happen down the road? So when you start stacking these things, the research need, there's been more research done in the last 10 years on fire service health, wellness, and safety and cancer than in the previous 100 years. And we need to continue to contribute to that research by developing data. And part of that data is us as firefighters collecting exposures, collecting what we do, both for our personal use and for that. So why track exposures relative to firefighter cancers? Why, we know that cancer is a problem, but to the point that both Pat, Lori, and Kenny made is, well, how much and why and how frequent and what kinds and what drove that? And what did you do as a firefighter that perhaps contributed to that? We know, firefighter cancer, firefighter skin is often contaminated by soot and toxins. Even if you wear all your PPE and do everything possible, wear your mask, wear your hood, wash your gear. Dermal absorption and inhalation are known to expose you to carcinogens. Carcinogens remain on the PPE if not cleaned. Even and today there's a research project going on what clean means, and that's contributed by tracking exposures, because we can look at it and figure out. So we know even if we do everything right, we still have these risks. We look at relative to behavioral health. We know that behavioral health is a huge challenge, an issue for today's fire service, and certainly impacted by what we've been through in the last 14 months with the pandemic, that everybody's impacted in one way or another by the calls that we go to, whether it's volume, whether it's criticality, whether it's a wear and tear stress injury, whether it's a critical event. 1 in 5 firefighters and paramedics suffer from some sort of post-traumatic stress injury or wear and tear stress injury in the course of their career. From data and studies, we know that firefighters have a greater potential to have a behavioral health concern, behavioral health injury, or even PTSD, and are more likely to commit suicide than the general population. So how do we get to that conclusion? How do we arrive at that conclusion? It's because we collected data. Well, now instead of fractured data that depends on the collection process for every scientist, every data scientist, every data engineer that's helping these researchers, we have the opportunity now to create this gigantic mass of data that not only will help you as an individual, will help drive some of these research needs moving forward. And you go like, well, but I don't, I'm not that active. And then you start peeling away the layers and go, well, it's only a garage fire. And you look at the photo, and that's, for many of us, a bread and butter. We look at that and go, all right, well, that's Wednesday. It's simple building fire. You're on the first 2 engine. You wore all your PPE. You had your SCBA on and used during the entire event. You wipe down, you clean your face, your hands. You got back to the station. You got the rig squared away, wash your SCBA, clean your mask, took a shower, swapped out your PPE, put on a clean uniform. You did everything right every single time throughout your entire career. And again, I don't care if you're career volunteer, wildland, it doesn't matter. You do it right every single time, and you still got sick 8 years later. Wouldn't it be nice that if that happened, God forbid that happened, wouldn't it be nice for you to not have to go, well, I think I went to a fire in April of 1989, and I'm going to have to go back and look and find that event. And you look at, for many of us, you look at what our records management systems were back when we started. It was paper. It might have been a journal on the watch desk. It might have been a call log. And then we got into electronic records management systems that, again, still are on many levels are not that sophisticated. So now you have an illness, and we have the need to go back and go, well, what were the things that maybe led to it? Did I go to a fire in a chemical warehouse? Did I run a spate of car fires that, before masks were mandatory? Did I was the gear washer broken in 5 years in a row and we didn't get it fixed? Whatever those things are, we don't have real data, but now we have the ability through the M4's exposure tracking app to be able to track that. In addition to the National Firefighter Registry, it's imperative that firefighters track their exposures. The National Fire Operations Reporting System and other data systems are working to connect what you do on an incident level every single day to your registration. That data combination is the best scenario to connect you as the individual, to give you the information down the road from a career diary perspective, and feed the research needs of America's Fire Service to know that down the road, 5 years from now, 10 years from now, 15 years from now, perhaps when your kids are coming into the fire service, the valuable data that you contributed through NFORCE tracking and through the National Firefighter Registry will help drive the research to make the fire service safer then than it is even today. So how do you do that? The NFORCE Tracker app is again, for firefighters, the best thing. It's free, and even better, it's easy to use. I don't care how untech savvy you are. If you have to hand your smartphone to a 12-year-old to figure it out, they'll have it done in 17 seconds. NFORCE is a personal database providing a detailed history of a firefighter's work and exposures in a private, encrypted, secure online environment, all available on your mobile device, all available for free. I don't care if you're an Android user, if you're an Apple user, it's in the App Store for both of them. It's important, relative to Pat talked about the challenges and the layers that go with this. It's important, and I can't stress enough, encrypted, secure online environment. It's N4s has taken many steps to ensure that your data is protected, so we don't have to worry about things like that. You can contribute your information and you can create that diary in a way that ensures that your information is protected. It's usable whether your department is on N4's analytics or not. If hopefully your department is on N4's analytics because they're aggregating that data and using it in a way to help make data-driven decisions in your department. Even if not, that's okay. You can use it as a standalone tracker for your career. It's easier when your department's connected through N4s and through an incident access code, because it would feed that information automatically to your portal. But if not, that's okay. You can do it while you're working over the fire chief going, hey, we need to do this. You can still get into the app and start collecting your information moving forward. When you get back from a call, pop open the app, a couple minutes. Again, after you do all the things you're supposed to do, get the rig squared away, get your SCBA cleaned up, swap into your clean gear, take a shower, make sure you're cleaned up, ready to go, and go, okay, I need to enter stuff in my career diary to make sure that I noted that call that I went to while it's fresh in your mind, because you know as well as I do that the pace that our life is and the pace the work life is, you're going to forget things if you're not careful. So when you get back and you get done with that incident, sit down, open up the app, put in your information, and that way it's got a permanent record. So download it now, create your personal database, give you the opportunity to track that. And at the same time, that data down the road will help inform and help drive what's going on with the National Firefighter Registry. Again, creating a data set for firefighters by firefighters to lead to a better research outcome in the near term, in the short term, and in the long term. So with that, I will hand it back to Dr. Moore-Merrell to entertain questions from the group.
Very good. Thank you, Chief Oates. Thank you to Dr. Fent, to Pat Morrison. So what a way to tell the story. All of you, thank you very much for the time and your presentation. So just to reiterate for everyone, the goal of the National Firefighter Registry is to track cancer risk over time. And we need to be able to link your workplace with your exposures and to those who get cancer and those who do not. That's important information as well. And so that's the intent. We have to have the capability and the research to be able to understand. That understanding can move us to actionable insights. Those actionable insights then can help us curtail or stop the incidence of cancer and the deaths that go with it. So please, please heed all of the things that you've heard. Look forward to the rollout of the National Firefighter Registry. Be ready to register. Understand that all security measures are being put in place to protect your information, to keep everything secure for you, but you contribute to your own legacy here by making a difference for firefighters in the future. And so they don't have to go through the cancers that we are seeing even today. So thank you in advance for planning to register, for registering when we roll out the cancer registry or the National Firefighter Registry. And thanks again to everyone today. So we do look forward to your questions, and thank you for joining us.